We talked about the exercise prescription for an individual with renal cell carcinoma, also known as skin cancer. So a little overview, there's going to be a little introduction, and then we will discuss what physical activity and exercise may look like for an individual with renal cell carcinoma, and then we'll go over cardiovascular, muscle strengthening, flexibility, and balance exercises recommended for these individuals. And then lastly, how this population's exercise differs from those of a standard American adult. So a little introduction. Getting diagnosed with cancer is very devastating and can be a difficult thing to cope with. However, being physically active during this time can help reduce cancer-related fatigue, anxiety, depression. It can improve treatment outcomes, and most importantly, it increases this individual's quality of life while they're battling through this cancer. So it can help if outside individuals and their peers are helping to motivate them and encourage them, as it's very difficult to have the energy and motivation when battling cancer, but it's very important to stay physically active and participate in activity. A main concern for exercise when an individual is diagnosed with renal cell carcinoma is that the first step for treatment is normally a partial or radical nephrectomy. So a partial is removing part of the kidney, and then a radical is removing the entire kidney. So this affects the abdominal region of the individual as they're healing from the surgery. So during this stage, there should be no heavy lifting, abdominal or core exercises, or bending and twisting until they are completely cleared from this surgery. So it's a little bit difficult to stay active during this time as they are recovering, but they should just focus on light walks and light stretching so they can avoid any type of strain or stress put on that abdominal region until they are fully healed. So what physical activity may look like for these individuals? First off, it's very important to understand their capabilities and that they've had adequate time to rest and recover if they're dealing with surgery and radiation. So it's important not to completely push them past their limits so they are able to heal properly. They must be cleared and approved by a doctor or specialist before participating in any physical activity. However, they are still recommended to get 150 minutes of exercise per week, but they are recommended to do light and moderate intensity. It's also recommended for them to participate in both cardiovascular and muscle strengthening exercises. And then their workouts should be very short, so probably about 10 to 15 minutes at a time, and then maybe do that 2 or 3 times throughout the day just to meet that 150 minutes of exercise per week, but they're doing just short workouts at a time. So some recommendations for cardiovascular exercises. Again, it's just encouraged they engage in light and moderate intensity cardiovascular exercises. So some light intensity exercise examples would be slow and controlled walks. This would be on a flat surface, maybe down the driveway and back, maybe down a hallway and back, very short distance. It can be seated cardio exercises such as seated marches or toe taps, or water walking, which is shown in the picture. Some more moderate intensity exercises will be brisk walking, so maybe a little bit faster, but still slow and controlled pace, and then maybe a little bit further of a distance. It could be light tennis or a little sport that they might enjoy, easily cycling or on a stationary bike, as well as household chores. Some muscle strengthening exercise recommendations is it's also recommended they have 2 to 3 days a week of strength and resistance training. And they are recommended just to do body weight and banded assisted exercises. So they're not trying to lift very much weight as they are recovering. So just some exercise examples would be chair sit to stand, which is what's shown in this picture, wall push-ups, banded pull-aparts, body weight squats, body weight calf raises, and then like shoulder press and lateral raises body weight, or they could add a 2.5 or 5 pound dumbbell if they are able. So for flexibility and balance, it's recommended that they stretch after any physical activity daily. There's many benefits to flexibility and balance exercising. So it helps improve range of motion and reduces muscle tightness. This is very helpful if an individual has been sedentary for a week or two due to treatments or surgery. So those flexibility exercises can very much improve their range of motion after being sedentary. It helps improves posture. It enhances overall mobility, and also it helps maintain their independence. So being able to do day-to-day tasks without needing assistance. So some stretches they can do is a standing quadricep stretch, which is shown in the picture, wall calf stretch, arm and shoulder stretches, and then ankle circles. Some balance exercises they may can do are heel to toe walks or single leg standing. So how exercise for an individual with renal cell carcinoma differs from the exercise a standard American adult would partake in. So exercise for these individuals, it's much more personalized and tailored exercise programs just to make sure they're doing everything appropriate and safely. So they might require a trainer or a specialist that can really help tailor their programs, make sure they are safe when recovering. Also, the intensity of their workouts must be symptom driven, meaning their workouts need to be determined based on how the patient is feeling. Um, and then another difference is that they benefit from shorter workout times, like stated previously, about 10 to 15 minutes per session, and maybe 2 to 3 of those sessions per day. Rather, a standard adult would probably just do one 50 to 60-minute workout in a day. Also, another difference is that they um, are recommended just to do banded or body weight strength training, as a standard adult might be encouraged to lift heavy weight and high rep strength training. Thank you. That's all.